All right, hi. So let's talk about something very important, which is part of the communication skills with patients. This is a very difficult and interesting one. It is the DNACPR, or what you hear that is called the do not attempt resuscitation or do not resuscitate CPR. CPR simply means cardiopulmonary resuscitation, which is, as we're aware, an attempt to get the respiratory and the cardiac system working again after either respiratory or cardiac arrest. It's a very difficult conversation to have with a family member or the patient themselves. So there is the approach that I have created called the SETS approach. So SETS is simple, and SET simply stands for the very first S is to start the discussion after establishing a rapport, with the patient, and then also taking a consent from the patient or the relative that they are happy to have that conversation. The next thing is there's a need to explore, establish, and assess what is understood about the care so far. So, this is a very critical and important part. You want to explore diagnosis, treatment, options, prognosis, possible outcomes for intervention, why it may not be of any use to the best scientific and medical knowledge, giving extra care. And then it comes to the T part. Here is to tell the decision, of course, it has to be politely, it has to be respectfully, and of course, it has to be in a non um, intimidatory manner, that the decision is a medical one and rest with the medical team. This is probably the hardest part of the SETS protocol. Then after that, you need to summarize to the patient or their relative all of the aspects. You need to check their understanding. And then, of course, the legal bit needs to be done where the DNA CPR form is filled appropriately and communicated across the medical team and other people involved in managing the patient. Then a strategy is formed for subsequent visits and also reminding the patient that the usual care would not be affected by the DNA CPR decision, as it only pertains to the fact that resuscitation would not be beneficial to the best medical knowledge. And so that would be also important as part of the strategy. Then the meeting is ended politely, and another consultation or discussion is arranged with the patient or their relative. And this at this junction, you like to thank the patient for their time and also schedule another meeting. I hope you find this video useful. Please like, subscribe, and follow the channel. And thank you to all of the people that have been watching the video and have been subscribing to the channel. Let's keep it going.